Good morning students. Today I will see about the introduction to orthopedics. The last class is about assessment part, subjective, objective, then investigation, diagnosis part. This class will see about special test. What is the role of special test? The role of special test is mainly for special test is the diagnostic criteria for our physiotherapy's hands-on approach. First we'll see about orthopedic assessment physiotherapy perspective in the special test. Then first test is a shoulder joint, shoulder needs test. Okay, the purpose of the test is that detect shoulder impingement. Then procedure passive forward flexion of shoulder. So positive pain indicates impingement. Okay, so goes to the arm movement, the forward flexion. You will in case impingement, pain radiates from the upper arms. Okay, this positive for the impingement test. Okay, in diagrammatic representation, therapist will assist assistants to provide the move the arm. Then patients will feel the pain on this impingements or either arm. Then second, shoulder Hawkins Kennedy test. Okay, purpose of this test is the assess impingement of supraspinatus tendon or subscapularis tendon. Okay, procedure flexion shoulder and elbow 90° with internally rotated. Okay, flexion shoulder 90°, elbow 90°, then internally rotated. Okay, then you will go for pain indicates the shoulder area, that is a impingement of the subscapularis or supraspinatus tendon. Okay, then we will go for shoulder drop arm test. Okay, purpose of the test is the detect rotator cuff tear. Procedure is the arm updated to 90°. The patients are lower slowly. Positive arm drop suddenly or pain. Suddenly drop பண்ணுவாங்க இல்ல pain is a pain present ஆகும். That is a positive test for abductor muscle. Rotator cuff is a shoulder, rotator cuff is clear. Okay, it is the diagrammatic representation is used for the therapist is the backward of the patient. It's supported to the movement of the abduction position and leg position. Then the therapist gradually release the hand by the gradually release. Then patient in case of the tear of the rotator cuff, sudden move on the shoulders. Second and third is the shoulder apprehension test. Okay, what is apprehension? Apprehension is the facial. In case of pain is mainly for facial expression is seen in the patient. Purpose of the test is to assess anterior shoulder instability. Procedure arm updated and externally rotated. Positive application of fear of dislocation. Okay, in this diagrammatic representation, patient for supine lying, patient therapist should stabilize the shoulder joint. Then will updated 90° and elbow 90°. Then shoulder external rotation. In case of any instability, we go facial expression felt on the patient. Then elbows, Coulson test. Okay, Coulson purpose of the test is the lateral epicondylitis test. Procedure resist the wrist extension while elbow extended. Resist elbow extension position. Wrist extension resist, that is pain and during the lateral side of the elbow. Okay, positive for tennis elbow conditions. Okay, then elbow or Mills test. This is also for the lateral epicondylitis condition. Procedure passive wrist flexion with elbow extension. Passive wrist flexion with elbow extension. Okay, pain at the same lateral epicondyl area. Okay, same confirmatory condition for lateral epicondylitis or tennis elbow. Then elbow tinel sign. Okay, the purpose of the ulnar irritation. Ulnar irritation is find out this test mainly for procedure tap between the olecranon process and middle epicondyle. Okay, so positive sign is that tingling along the ulnar course distribution. Okay, that is the acute area, the olecranon and the middle epicondyle, the center of the space is tap over this area. Then Nallano case course area is a tingling sensation numbness or feel in the patient. In case of the presence of the patient, we will confirm it for the ulnar distribution, is a ulnar compression. Then you will go for wrist balance test. Okay, wrist the purpose of the carpal, find out the carpal tunnel syndrome. Then procedure flex the wrist and the hold for 60 seconds. Okay, 60 seconds. Then you will go for positive numbness or tingling in the mediano distribution area. So it is the test is positive. It will confirm a diagnosis for carpal tunnel syndrome. Then you go for wrist tunnel signs. Okay, elbow tunnel sign is a cubital tunnel. Wrist tunnel sign is a carpal tunnel. Okay, this is a small differentiation. Okay, purpose of the wrist is a median compression. Procedure is a tap over the carpal tunnel area. Carpal, this is the carpal tunnel area. The wrist palmaris for the wrist is the carpal tunnel area. Tap over the carpal tunnel is in case any distribution area is the pain or numbness shown in this area. In case it's present of the positive symptom, the median is also compression of the conditions. Okay. Then wrist Finkelstein test. Okay, this purpose of the test is decoding tenosynovitis. It will be positive for this test. Procedure: patient make